I think, Mark, it's an important question because we do have some data, and this will be shown in the next few weeks or months, but I think the story has yet to unfold. We don't know exactly what these resistant variants mean. We know that these variants are resistant to the protease drug. And the implication is that these individuals did not have adequate interferon responsiveness, and hence these variants were allowed to thrive and were selected out. So the question for us is, does this have a meaningful clinical impact for that individual patient? In other words, are we going to be able to salvage them with some other therapy down the road? Could we retreat them perhaps with a more aggressive regimen? We don't have the answers to this yet, but I think we have to proceed cautiously simply because we don't know what the implications are for that individual patient who develops resistant variants.
We'll certainly touch on this issue more during some of these cases that we'll discuss. But I think that really is an important point. But we haven't touched on this today, but it is important to note that there are many other HCV therapeutic agents in development that are really quite promising, but not in the same time frame that the proteases will be available. So certainly that's one of the things that we can address and look forward to in the future is potentially, even at this meeting, some data on using 4 drugs, including peginterferon, ribavirin, and protease. So we'll talk more about that. What I'd like to do is shift into what is really a case-based discussion. And I'll tell you about the first patient. It's a 32-year-old law student who acquired hepatitis C during a very brief period of injection drug use, otherwise healthy. She was diagnosed after donating blood, but has never seen a specialist. Her primary care physician has identified hepatitis C genotype 1, subtype A, viral load of 540,000, ALT is 31. So this patient has seen a press release, perhaps a news channel, some kind of information about these new drugs, and they come in to be seen. So let's go ahead and vote.